contact lens dropout with a scleral lens. And then patients that are experiencing dry eye symptoms with their current lenses. So I have a lot of patients that no matter what soft contact lens they wear, they still get dry eyes, or they can only wear the lens for a few hours. And if you switch them to a scleral lens, you might help them stay in the lens longer, and they'll be more comfortable. So there's a lot of discussion in the research and a lot of articles that you might read, and it addresses the issue of should you fit small diameter or large diameter scleral lenses. So which ones are better and what are the differences? And each practitioner has their own views on things, but we'll just kind of go over the differences. Smaller diameter lenses are definitely easier for the patient to understand. They have a lot less apprehension to the lens. And you can see here, this is a 14.9 diameter lens compared to an 18.2. So a lot of patients, they're very familiar with the contact lens that's maybe 14.0, 14.5 millimeter. So when you switch them to a lens that's maybe a 14.9, the diameter is very familiar to them. If you change them to a scleral lens that is 18.0 or maybe even larger, that can sometimes be very intimidating to the patient. Also, we have to ask the question of how much oxygen is really getting to the cornea. So you have your scleral lens that is a certain amount of thickness, and then you have the tear layer between the lens and the cornea that is a certain thickness. So how much oxygen is really getting to the cornea? So there's a lot of different articles out there, and here's one of the most recent ones, that most of the articles come to the same conclusion, that you want to try to make the scleral lens thickness as thin as possible, and then you also want the tear layer to be as thin as you can. With this combination, with a high decay material of the scleral lens, that will minimize anterior segment hypoxia. So you can possibly increase the amount of oxygen getting to the cornea if the actual scleral lens is thinner and you have less clearance from the cornea to the lens. So in summary, a lot of these studies have shown that less clearance might be better for long-term corneal health. Small diameter scleral lenses can also help you with the issues of the scleral shape and toricity. This is a study done by Tina Graff, Patrick Caroline, Abe Vanderwerf, and Randy Kojima, all very, very well known in the scleral lens industry. And what they did was they wanted to find out how the scleral lens shape changes as you get further away from the limbus. What they did is they set a cord length of 15 millimeters, and then they did a cord length of 20 millimeters. So this is saying, here's the top of the cornea. So with a 15 millimeter cord length, that would be here. So, and then the 20 millimeter cord length, which is out here. So this is closer to the limbus, and you just keep getting further and further away. So they want to see how does the scleral shape change. So about 10 to 15 millimeter cord length, you can see that the scleral angles are all pretty similar. We've got, 38, 37, and maybe 39. but they're all basically very similar. And now when we go to the 20 millimeter chord length, you can see that the shape starts to have a lot of variation. So you have 36, 41, 42, 37. So all of these degrees are a lot different. And this is just showing you, as you move away from the limbus, the sclera shape starts to become more and more irregular. They're not spherical. And this is just a graph reiterating that fact that with the limbal angle from 10 to 15 millimeters, it's all very similar. But then when you start going from 15 millimeters out to 20, you have these big variations of angles. So if you can keep the lens smaller, you won't have to deal with as many problems with peripheral curves, the scleral toricity, and some of these other problems that you will have if you go to a very large diameter lens. So the MSD is a very good option for you. The MSD lenses use a simplified, very intuitive fitting process. The diagnostic lenses are very easy to select. The lenses are very easy to fit. And it's very easy for simple novice fitters to advanced scleral lens fitters. You will get very predictable, repetitive outcomes. So when you make certain changes, you will notice that it is always very consistent, the changes that you make. So then you become more confident when you're fitting more patients about those changes. You can make changes to the lens power and the profile curves without necessarily trialing multiple lenses. And that's where the MSD compensation tool comes into play, which is very useful. And what that does is it reduces the chair time and it maximizes your success. The MSD lens is also designed to get maximum oxygen delivery to the cornea. I work with a lot of different scleral lenses of different shapes and sizes and thicknesses, and the MSD lens is definitely one of the thinnest lenses on the market. So I know that I'm getting very good oxygen to my patients' corneas, so that makes me feel very good about fitting the patient with this lens. Because the MSD has a distinct thin profile, that does allow for more oxygen to get to the cornea. It is best to fit a lens that has a thinner profile and not thick for the tear layer for support. The limbal clearance should also not be excessive, so you can ensure maximum oxygen to the stem cells, and that also potentially can reduce fogging of the lens. That combination equals maximum oxygen to the limbus and the central cornea. So the MSD lens is in line with studies about oxygen to the cornea, which will give you long-term corneal health. And this is just an OCT image that I had of two different lenses that I work with. You can see with the MSD lens, it is very thin over the limbal area, which will give you the most oxygen, compared to another lens, which is about the same thickness all around. So you're getting a little bit less oxygen to the limbus in this case. So you can see that the MSD lens is thin, so it's going to allow for maximum oxygen. Something else that I have noticed personally is that MSD lenses have less fogging than other scleral lens designs. And I think that has to do with the smaller diameter of the lens and the thinner amount of central clearance.